Good afternoon, everybody. I'd like to, I'm very proud to welcome Dr. Vaibhav, a good friend, to today's meeting, and he's going to be talking to you about the Royal Flying Doctor Service for Remote and Oral Health. Is that better? No.
Come closer.
Remote and Oral Health program. Vaibhav started his dental journey at Adelaide Uni and where he completed a Bachelor of Dentistry. He recently finished his law degree and is currently completing his Masters in Health Economics in his free time. Originally, he moved into private practice, and Vaibhav now is the senior dentist at the Royal Flying Doctor Service. I'd like to also congratulate him on his recent award. He was awarded the Rural and Remote Health Professional of the Year, and it was presented by the Government Dental Marston in November this year. So congrats on that.
Thank you, everyone. And everyone can hear me?
Yes.
So it is such a pleasure to be here, and thank you for such a warm welcome and inviting me to come in and share a little bit about this program that I get to be a part of. It truly has been an extraordinary journey, and I am hoping to share a little bit about myself and this program. So somebody may have to keep me on time because I do love to have a good chat, so feel free to let me know if I'm going over time. So I just wanted to echo the acknowledgement of country. I am really proud to be sharing knowledge on Ghana country. And I just did want to take a moment and ask the people in the room, is there something interesting or something that they would like to share about Ghana land or Ghana culture? Oh, we've got a...
Yes. The Ghana name for this land is Red Kangaroo Place.
Red Kangaroo Place.
I have not yet seen a red kangaroo, but I'm looking forward to it.
There are kangaroos in the streets in Hectorville this morning.
Oh, there we go. There we go.
There was a kangaroo.
Thank you, Hayley. So Hayley's another guest today. She's a budding dentist in her own right. So welcome. So I'm going to start with a little bit about myself. I did want to share a photo with a full head of hair because I do need you all to believe that actually existed. So I have had a really interesting journey going through my professional journey. I was born in India, I grew up in New Zealand, and it was a real sliding doors moment that brought me to Adelaide. I had actually moved to the Gold Coast from New Zealand to start my dental degree, but was offered a second or a third round offer for dentistry here in Adelaide. And being such a prestigious school, of course, I had to come here. And I did, and what a journey that started. So I was able to learn from some of the best dentists and specialists in Australia. I had the ability to do placements in our special needs unit, which I don't know if many of you know of the special needs unit that is at the Adelaide Dental Hospital. It has been at the cutting edge of treating some of our most vulnerable patients for a very, very long time. So, for instance, for patients with hepatitis C, they were at the forefront of treating patients at the start of the HIV pandemic, people with psychological needs and disabilities. So it's an amazing institution. And I really learned what it means to connect with patients and really look at what their context is and what has led to the situations that they are in, not just from a health perspective, but from a socioeconomic and cultural perspective. And while I was at university, I had the opportunity to volunteer with a development project in Uganda. So this is a photo of me working with some really, really phenomenal women in a remote Ugandan village. And I'd like to say that I've always had a lot of sense and responsibility, but that's actually a lie. This is me about to be the only person that fell out of this whitewater raft in a rapid called the Dead Dutchman. And you don't have to use your imagination why it's called that, whilst I was in Uganda. So,
walking on water.
yes. So, anyway, that did, however, put some sense into me. So, I spent a little bit of time working in Western Australia in the central wheat belt there. So that's where I fell in love with rural areas, and finally came back to South Australia, and by coincidence ended up sitting across from my now boss at a wedding, and that led to me starting to work with the RFDS. And I want to share a couple of these photos to. I'd like to start by sharing a couple of photos of some of the places that we go to in South Australia. So you can see a pub that's surrounded by water there. That isn't heavy rain actually, it's a burst water main, but it does make for a really good photo. So, but I wanted to share this photo of Maori because Maori is has a fascinating history which stretches far back into history. It has a really strong connection to the First Nations people that have lived there for a long time. Some of them include the Arabana people. But this is also where the Afghan Cameleers helped to lay down the train line that connected Darwin down to Adelaide, ended up settling. So what's really fascinating here is that this is a true, geographically a place which connects our more contemporary history with our ancient history. And as many of you may or may not know, but the Cameleers who helped build this railway weren't allowed to settle in European settlements. And so they had to settle with the local Aboriginal people of this area. And we now work with some descendants of these Aboriginal Afghan people. And so it's a really interesting, it puts a really interesting context to where we go and where we work. So before I talk a little bit more about the program, I want to share a few words from some of our patients that we see. All right, I might come back to that, and so I'll come back to that video. It's a really fantastic video of some of our patients who we see in Murujul, which is the community that are the custodians of Uluru. So this map shows the extent to which the oral health program that I currently manage travels. So down the bottom you can see Adelaide, and up the top you can see some areas that have been marked out as East Arnhem. So when you normally go to the dentist, you would often go just down the corridor to move from room to room. But I have to get on a plane and pack everything with me and travel anywhere from 1,800 to 3,000 kilometers to my next clinic. So we provide a 2-chair dental clinic in about 14 locations across Northern Territory and South Australia. We will pack 350 kilos of equipment into the back of one of our single-engine aircrafts, and we will fly to locations where there are no dental facilities whatsoever. And we'll set up. Takes us about an hour and a half to set up. We'll set up 2 chairs, and we will undertake anywhere from 40 to 60 appointments every week. people in remote communities will have the opportunity to access a dentist in one of the dental chairs and a hygienist in the other chair. So we're running 2 chairs. And with our dentists, we not only have general dentists, but we have paediatric specialists, we have a special needs consultant, and we even have a forensic odontologist, which thankfully we haven't needed to use their full scope yet. So that's been quite valuable. So we have been able to expand our services into the Northern Territory, and that's part of what my job has been, to commence working with remote Aboriginal communities in Central Australia and also in the top end. So in the last 5 years, we've been able to start working with communities such as Kiwakara, which is just across the border in Western Australia. And I'll come back to that community because it's got a very interesting history. In Kintor, which is a self-determined community that also has a very interesting history. We also have the immense privilege of being able to fly into Uluru and support the First Nations people there. And something that I'm incredibly excited about is next year we will be commencing dental clinics in remote East Arnhem in Lanapoi homelands with the Yolngu people, which is, I had the privilege of being able to travel out there this year, and let me tell you, it is incredibly beautiful and the culture is very rich. In South Australia, we support many pastoral communities through our clinics in places like Kingunya, and we also support mining communities and other South Australian communities such as Yunta, Inaminka, Andamuka, Lee Creek, Mari, and also in Port Augusta we have some support services as well. And as I was saying, so we pack everything that we need. So our job is to take dental services where there are no public or even private dentists. And we've created a system where we don't need established infrastructure. For you to build a dental clinic out in a remote area, it can take anywhere from $800,000 to $2 million to set up bricks and mortar. Well, my entire program, which delivers over 50 weeks of service in a year, costs about half of that. So we have been able to change up and utilize the latest technology, which incidentally is the RFDS way, harnessing novel technology in being able to deliver the finest care in the furthest corner. And we have absolutely been able to work with our technology partners. We've been able to shrink a dental chair with all of the drills and all of the paraphernalia and the tools that you see into the size of a cat carrier. We can actually put it into a commercial aircraft's as carry-on luggage and take it to wherever we need to go. And we take our dental chairs, we take all of our equipment, our medicaments, anything that we need. And what that's actually done is it's actually allowed us to change the way that we deliver care. We only go to places where we are invited. So we have to be invited into a community to go there. And what that sets up is a conversation around, well, how does your community, and it doesn't matter whether that's an Aboriginal community or a non-Aboriginal community, any community, how do you want us to deliver care? Who do you want us to prioritise? And what sort of a setting do you want us to deliver care in? And so we will often be asked, please go into aged care, please go into early childhood centres, please go into primary schools, or please set up for a couple of hours at the youth drop-in centre. And we can do all of that. We go wherever we're asked and we can deliver a really high level of care. This program has been accredited with the NSQHS accreditation standards to the hospital standards. We are now in our third round of being accredited. So there is no question about the quality of services that we deliver. And I think what also sets us apart is that we are also, to my knowledge, the only service providing preventive dental care in remote areas, because that is universally something that people in our communities are wanting. They want to be in control of what their health journey is, not just for their mouths, but for their general health. And we know that oral health is connected to chronic diseases. We know that having poor gum health means more likelihood and poor control of diabetes. Having poor diabetes means having poor gum health. We know that oral disease contributes to heart disease, kidney disease. So there is, and all of these diseases that I'm mentioning, the incidence and the morbidity and the mortality, or the impact to people in remote communities is 4-5 times greater. In the case of kidney disease, in some of our remote Aboriginal communities, people are 50 times more likely to have kidney disease than people living in urban centres. So why would we not provide an option for preventive care to our wonderful remote communities? So that is somewhat of the ethos that we work with. If I can deliver a level of care in a private practice here in Adelaide, why in Australia can we not deliver the same quality of care anywhere remote? We should be able to do that. And I think we have really worked quite hard and been able to deliver on that promise. So now I want to take you on a journey out to the Central Deserts. This is Kintor, or Walanguru in Pintupi. This is Pintupi Homelands. I really want to acknowledge this place because this was the first Aboriginal community that we were able to partner with. They invited us in, and they invited us to set up a dental clinic. They spent a lot of time and effort helping us to understand and learn the depth of culture and what the connection to culture actually means for them. And this is what we get in return, being able to visit some of Australia's most incredibly beautiful places. I've been very lucky to travel around the world a lot, but Australia, honestly, is one of the most beautiful places. And I encourage everybody to get out and do a road trip out to some of our remote Central Deserts places. They are accessible and they are wonderful, and they do, many of them look like this, if not better. So what did that look like? So we spent many months discussing what health actually means for communities. And so what we learnt is that in remote Aboriginal communities in particular, health and disease are two very different concepts. And it's something that I feel we should adopt in Western medicine as well. Health is something that is about your whole life. It's a holistic approach. People spend a lot of effort living a healthy life. And it is done out in nature, it is outdone in culture, it's done through interactions with your family and your friends and your community. Disease is something very different. So disease is something that happens in a clinic, it happens in a sterile space, it happens in a hospital, it happens in all of these spaces. And the concepts of health and disease need to be separated. And that is also why we have two dental chairs that we run. The dentist is there to fix the disease, but the hygienist is there to help our patients travel that journey of prevention and of health. And so we have adopted and tried to create a balance between our amazing Western medicine, evidence-based learning with the incredible wisdom that exists out in remote communities. And I want to take you a little bit in a similar area, but just across the border into WA from Walanguru. So who knows, well, I think it's up there actually, so I can't ask that question, but would you believe the last Aboriginal people to make contact with non-Aboriginal people was in 1984? 1984. So they were the Pintupi Night. It's a fascinating event in history. And I encourage you all to go and look up this article or find out a little bit more about this group of people. Now, what I want to share with you is that when these people made contact with non-Aboriginal people, they were able to make contact with some of their Pintupi community before making contact with European and Western people, and they were enabled to have a bit of a graded exposure. They were able to have that interaction on their own terms. when they did interact with the Western health systems, they were assessed and and their health was very much investigated. They were incredibly healthy. There was no heart disease, there was no kidney disease, there was barely any health issues. There was maybe a little bit of gum disease, but that was it. And so we know that they have had a connection with their culture that stretches back 20, 30, 40,000 years. And they have been able to live really healthy, wonderful lives connected to culture and being able to sustain themselves in what to us would seem like a really inhospitable place. So the question is, or really our task is, how do we start to incorporate some of this wisdom that is inherently there into the work that we do? And that is something that we have been able to go on a bit of a journey with this program, and something that I'm really proud of. Now, the Pintupi Nine are incredible people. They are incredible artists, and this painting that Beyonce is very proudly standing in front of is actually done by one of the Pintupi Nine. So when we go into community, they'll often tell us, we've just been to the Paris Art Fair, or we're going to be going to New York to exhibit our work. And they are some of the most well-regarded artists that we don't know about in Australia. And so I just wanted to share this other aspect and the utter delight and surprise that we've had working in our remote communities, learning about aspects of culture and life and the richness of heritage that we have here in Australia. So that is an incredible journey that we get to go on. And what does that look like? So not only do we get to go out and deliver some really amazing health care, we are then invited to participate in events and in activities in community. And so this is one of Kiwakaro's foremost goanna hunters, and she is incredible. So this is the team going out goanna hunting out bush with Yakulchi, and then afterwards sitting around a fire, roasting goanna tail and sharing stories with each other about culture and what it means to be in that place for that moment. So I just wanted to, I did want to leave some time to for people to be able to ask some questions. So that is, if that's okay, or yeah.
We could have a microphone. No. Okay. So first, thank you. Yeah, Jim.
Thank you for that. I spent a bit of time while you were talking thinking about what you said, where you only go when you're invited in. So what dental services are there for outback communities that don't invite you in? I would have thought there's a sort of a government basic for medical and dental, and so to me it seems there's gaps.
I think one thing that I've learned working remote is that our health system is actually quite fragile, and there are many gaps, and many people do miss out. It is something that is inherent in the system, but there is also an element of we have learned by imposing health services on a lot of people that they choose to then not engage. So do we invest in going into places where we're wanted? I guess there's a bit of a distinction here. So my program is more around prevention and chronic disease management, and so it's more of it requires people to go on that journey with us. Whereas emergency medicine, which is retrievals and getting emergency care, everybody has access to that regardless. So RFDS will fly wherever it can to retrieve somebody if there is an acute emergency episode. So that is universal coverage. But I guess what my program is more about is about that chronic disease management, and that requires communities to partner with us. There is no point in us going somewhere where people do not want our type of service, or they don't think that RFDS is the right partner for that health journey. So we want to respect that choice rather than try and stop people from accessing care, if that makes sense.
My dentist seems to always attack me with an X-ray.
Yes.
How do you manage in that area with X-ray machines? Do you have any?
Yes, so we have digital X-rays just like you have in your private practice. So it's about this big now,
Right.
and we have digital sensors that plug into the laptop, and it's a really critical aspect of the infrastructure.
Thank you.
Just for your next.
So how does your engagement with community look like when you're not there? In the sense like, is there some form of telehealth, some form of, or do you have local people that basically are like, I don't know how to put it, it's like support people that basically, okay, they can triage things. So how does this work when you're not actually present?
So part of the design of the service, that's a very good question. So part of the design of the service is that wherever we go, we need to have partnered with a local health service. So in South Australia, there are RFDS run health centres, so Andamuka, Marareli and Marla. So that's very easy for us. But everywhere else we go, we try and partner with a local health service. So whether it's an Aboriginal medical service or if it's a SA Health or NT Health clinic, there are a couple of places that we don't have access to that. But you might have seen in the media recently about William Creek and RFDS partnering with the Outback Communities Association to set up a virtual emergency centre, which is unmanned. So we're really leaning into that new technology, and that's some of the projects we get to participate in as well.
There's Rajiv, and then.
Vaibhav, the funding is completely by government, or you have private funding? And because I'm assuming none of your patients have Medibank access, right? Or Medicare access.
So all of our patients, so the funding question is always a really challenging one. So the way that the funding works is that we receive Commonwealth funding. So RFDS has a Commonwealth contract for delivery of emergency retrieval and primary health care for chronic disease management. So that contract is basically saying we're paying RFDS to do emergency retrievals, but we're also paying RFDS to ensure that people don't get so sick that they need the emergency services. So we get funding for that, but that doesn't cover everything. So we receive zero capital funding. That's all donor-based funding. So all the equipment that we travel with has been fundraised. And one of the other aspects of my job, and one of the reasons why I'm doing some of the study that I am, is creating public-private partnerships to enable health services. So that's another thing that I do. But I also like to come and speak to people like yourselves, because if you would like to support services with the RFDS, I hope I've demonstrated that all the money that is donated to the RFDS goes to these critical services to some of our most vulnerable communities.
Most interesting talk you've given us. I'm not sure if you're aware, but this club has actually got a program to sponsor 2 Aboriginal PhD students in the area of understanding chronic disease management in remote communities. In other words, to do it in a culturally appropriate fashion. And that seems to me what you're already doing.
Yeah, I didn't know that. That's excellent. I mean, it would be great to be linked.
To me, there might be some good linkages there.
Absolutely, yeah. We are always looking at wanting to and needing to incorporate First Nations-led research into our program. So that would be fantastic.
John, you were next.
Yes, thank you for that. That is just eye-opening. I'm hopeful that you might have some funding, if it's Commonwealth funding, to actually be available to, when you go into communities, be available to go into school to the next and younger generation, so that you are educating them in actually prevention from very low years.
And I think you'll be very happy to know that the majority of our communities put that as a really high priority. So
Yes.
even if we thought that might be something that we may or may not do, it is demanded of us when we go into communities. So we really do put in we put in a lot of effort into creating a system where we can have regular visits into schools, because with young people you need that repeated contact. You want to reinforce the message.
To build that trust.
Exactly. And we're seeing the benefits of that. I think, coming back into community and seeing these young kids who thought you were just this crazy, scary person, and at the minute that you land, they're just mobbing you, going like, I want my teeth to be seen. I think I have worked many years in private practice. That has never happened. I've never walked into my clinic being mobbed by patients going, see me first. So that's a bit unusual too.
Well done.
So Vaibhav, following on from that, I understand that a dentist is one of the most feared medical persons in the profession. How do you handle that when you're going into those communities?
It is very much about moving at the pace of trust, and I think that is something that is very challenging, I think, in private practice, because we do have a lot of appointments. We need to get through our patient list and things like that. So one luxury that we do have with this program is that we can spend a lot of time showing people what it is that we're trying to do. We spend a lot of time with family groups. So we'll bring out our tools of the trade, and we'll get people to see, look, touch, smell, interact, and basically create a relationship with the whole dental setting on their own terms. And then they sort of guide us on the pace that they want to go. So some people will launch right in, do the fillings, do the extractions, and other people, they will take many months, maybe even a couple of years to come back. I have a story of this lady who was so scared, and she was so ashamed because all she had were broken abscess teeth, and they were like that because there was just no dentist until we came along. And then after 3 years, just the other month, she rang us up and she was so excited, and she said, I have been able to get up the courage to go and get dentures made, and I went home and my granddaughter said to me, this is the first time I've seen you smile. And these are the sorts of stories that really, you can't put that in a presentation.
No.
Thank you.
Okay, final question, I think. Yeah, thank you.
How do you coordinate your service with other parts of RFDS in terms of the general medical programs as well? Do you work together, or how does that work?
Yeah, that's an excellent question. So there is, this is a very unique program because our contract actually demands that off of us. So my manager, the executive general manager for primary health services, she has basically created an overarching framework, which is our 4Cs comprehensive health management framework, and that basically encompasses all primary health services, so our chronic disease GPs, nurses, physios, allied health such as dietitians, us, dental, remote area clinics, into a coordinated network where we are a data-driven service. So we risk stratify our patients, and for our highest risk patients, we have to coordinate their services across all medical services. And we are actually embarking on some new research which is trying to link chronic disease management or longitudinal care with the number of retrievals that are happening within community. So we're trying to see whether this coordinated care is having a positive impact on the number of emergency retrievals. So that's a really fascinating, that aspect of this organisation and this program really fascinates me.
Thank you. Thank you. They've jumped ahead. That's where the bit that I say, first I say thank you for informative, interesting talk, and thank you for everything you do on behalf of the Royal Service and myself. I'd like to present you with Vaibhav as a token of appreciation. And now